Thanks for joining us and our first guest, and her name is Lindsay Penrose. Lindsay is a certified Medicare specialist. She's licensed with 8 insurance companies here locally, and she is with Benefit Reps of America. She provides assistance to those who are new to or already have Medicare. And with all the information you received during this time, if you were in that window, it's no wonder it's such a challenge to know what plan that serves you best. So I've been through this in the last couple of years, and believe me, you need some help. And Lindsay Penrose is here to do that. Welcome to Seniors Rock Radio, Lindsay.
Hi, Joanna. Thanks for having me today.
Thanks,
Absolutely.
and thanks for joining us. Lindsay, let's start off with can you tell us what is Medicare and who does it cover?
Yeah, so Medicare is a health insurance for those who are 65 and older and also on Social Security disability. So we focus on the Medicare Advantage plans. Medicare Advantage bundles your Part A, your Part B, and Part D coverage into one plan. And they're great because they also will offer some extra benefits that original Medicare doesn't cover, like vision, hearing, or dental services.
Interesting. And, Joanna was talking earlier about how everybody's being flooded with information now because we're in the annual enrollment period. What exactly is the annual enrollment period?
So yeah, annual enrollment period, definitely there's a lot of advertising out there. It's a busy time of year. So annual enrollment period is a time set aside each year for changing your coverage if you choose to do so. So this time runs from October 15th to December 7th. The new plans are released to the public during this time. And each year, the insurance carriers change their plans and they tweak their benefits, so it's a great time to review your plan to make sure you know what you're going to have going into the next year.
Very good. Thank you for explaining that because, everybody throws these words around. It's like a medical doctor throwing words around. Nobody knows what they're talking about until you get some training and you get some explanation. And so I'm going to ask you this. I have a PPO with my Medicare, and I think that's the same as an Advantage plan. Is that, and why are they so popular?
Yeah, Medicare Advantage plans can be a PPO, meaning you can go in or out of network. Or they have HMO plans as well, meaning you just stay in network. One of the advantages to these plans is in Rochester. Their networks are so large with these plans because of our two main hospitals, Rochester Regional Health and U of R, that you have a lot of accessibility. So either way you go with one of these plans, they will cover you. And with you being on a Medicare PPO, it's safe to say that's most likely an Advantage plan.
Okay, good. Thanks for explaining that. Now, okay, so there is tons of information out there. So some folks might say, well, why do I have to go in and have an appointment or talk to you on the phone, to understand this? Well, take a look at it all, folks, and you try to figure it out. But people are trained and people who are, I believe, licensed to help you really can get rid of all the things that don't mean anything to you. They really zero in on the things that are important to you. What are some other reasons, Lindsay, that someone might want to schedule an appointment? Maybe you've seen some things.
Yeah, so like I was mentioning, the plans are constantly changing each year. The insurance carriers, they tweak them, they add new benefits, they may reduce some other benefits. So if you don't do a review, you might not know what you're going to get for the next year. So it's important to make sure you know what you're receiving. And we also will do a personal review where we look at your medical needs, like your prescriptions, your doctors. There might be a specialist or a dentist that's really important to you. So determining which plan aligns with those needs is one of the requirements that we want to meet for you during the appointment. And some people will even go years without a review, but medical needs are constantly changing with everyone. So a yearly review will assure that you're set up for the next year to get that coverage that you may need.
Oh, those are great points because guess what? Things change as Lindsay just said. And if you're just tuning in, we're talking to Lindsay Penrose. She's with Benefit Representatives of America, and they're on Ridge Road in Greece, New York. So, Mike, I think you had another question.
Well, yeah, I was going to just ask because, is Lindsay, what you just explained, it sounds like it would be important for somebody to have an annual review. Are there any fees for your service in doing that?
So, Mike, this is actually a very popular question. People will call in right away and say, how much do I owe you if I make an appointment? And I'm happy to tell them that there is no cost for our service. Medicare clients never pay us a penny. We do the review for you with no charge. Even if your plan stays the same, you still won't pay us. If your plan does change, great, we're happy to service you, be your agent for the plan, but you're never going to pay us anything.
Excellent. Thank you so much for joining us today, Lindsay. And again, she's with Benefit Reps of America. She's a Medicare specialist, and you can find out more about your own situation by having a free Medicare consultation with Lindsay. And all you have to do is call, and they'll check this number out. If you can't remember this, I don't know, you have to study it. Anyway, it's very easy. Ready? 585-663-6333. 585-663-6333. Of course, you can always Google Benefit Reps of America. Thank you, Lindsay, for joining us.
Thank you,
Thank you for
Lindsay.
having